Hi folks, this is Jason, Certified Financial Planner and host of Fighting Words Financial. Welcome back to the channel. Today we're going to talk about Medicare Part A. This is a primer on the hospital insurance portion of Medicare. When you apply for Medicare, you'll be automatically enrolled in Part A. It covers hospital stays, hospice care, and some skilled nursing care and some nursing home care that you may need after being hospitalized for a stroke, a broken hip, or other health events that require rehabilitation in a skilled nursing home facility or other facility until you can get back on your feet. I'm mentioning this first because it's important to note that Medicare Part A nursing home care benefits and long-term care hospital benefits are actually very poorly understood by the general public. Many people think that all of those costs are covered. They are definitely not. If you end up in long-term care or custodial care, Medicare does not pay for care in a skilled nursing facility beyond the first 100 days for each health event. Medicare Part A hospital insurance covers skilled nursing care provided in a certified skilled nursing facility in certain conditions for a limited time on a short-term basis, if all of these conditions are met. You have Part A and have days left in your benefit period to use. Each benefit period has a limited number of days to use. You have a qualified hospital stay first. Your doctor has decided that you need skilled daily care. It must be given by or under the supervision of skilled nursing or therapy staff. You get these skilled services in a skilled nursing facility that's certified by Medicare. You need these skilled services for a medical condition that's either a hospital-related medical condition treated under your qualifying 3-day inpatient hospital stay, even if it wasn't the original reason that you were admitted to the hospital, or the condition started while you were getting care in a skilled nursing facility for a hospital-related medical condition. For example, if you developed an infection that requires IV antibiotics while you're getting skilled nursing facility care. Your costs will look like this. During the first 20 days, for days 1 to 20, there's going to be no cost to you. From days 21 to 100, you're going to pay a copay of $176 per day. From day 101 on, you pay 100% of all costs associated with care. During that 100-day covered period, not all care that you receive will be covered under Medicare. There are some things that aren't covered. Skilled care is nursing and therapy care that can only be safely and effectively performed by or under the supervision of professionals or technical personnel. It's health care given to you when you need to be in a skilled nursing facility or have skilled therapy to treat, manage, and observe your condition and evaluate your care. Medicare Part A covered services include, but certainly aren't limited to, a semi-private room, meaning a room that you share with other patients, one or more, meals, skilled nursing care, physical therapy, occupational therapy, speech-language pathology services, medications, medical supplies, ambulance transportation, dietary counseling, and swing bed services. Medicare Part A hospital insurance covers inpatient hospital care when all of these following are true. You're admitted to the hospital as an inpatient after an official doctor's order which says that you need inpatient hospital care to treat your illness or injury. 2, the hospital accepts Medicare. In certain cases, the Utilization Review Committee of the hospital approves your stay while you're in the hospital. So the inpatient care that you receive in the hospital under Medicare Part A is not going to be completely free. There is a $1,408 deductible for each benefit period. For days 1 to 60, there's essentially a $0 coinsurance for each period, meaning you don't really pay much beyond the deductible except for costs that are not covered by Medicare Part A. From days 61 to 90, if you're hospitalized, there's going to be a $350 per day coinsurance charge for each day of the benefit period. For days 91 and beyond, there's a $704 coinsurance charge for each lifetime reserve day after 90 days for each benefit period, up to 60 days of your lifetime. Beyond the lifetime reserve days, you will pay for all costs associated with care. Medicare Part A hospitalization benefit includes paying for services like semi-private rooms that you share with other patients, meals, general nursing, drugs as part of your inpatient treatment, and other hospital supplies and services. One important thing to note is that there is inpatient mental health care that is provided in psychiatric hospitals. It's limited to 190 days over your lifetime. Medicare Part A inpatient hospital care includes care that you get in acute care hospitals, critical access hospitals, inpatient rehabilitation facilities, inpatient psychiatric facilities, long-term care hospitals, inpatient care as part of a qualifying clinical research study. Medicare Part A does not include private duty nursing, a private room unless it's medically necessary, television and phone in your room if there's a separate charge for these items, and personal care items like razors and slipper socks. The second thing that's really understood is the long-term care hospital services. Medicare Part A hospital insurance also covers the cost of long-term care in a long-term care hospital, but only for a limited time, and there are lifetime limits even if you have multiple long-term care events. And there are separate benefit periods for each event. Your costs, in a way, look a lot like the inpatient hospital benefit for Medicare Part A. Your costs for the benefit period look like this. Days 1 to 60, you're going to pay that $1,408 deductible. Days 61 to 90, you pay a $352 per day coinsurance. Days 91 and beyond, you pay that $704 coinsurance for each lifetime reserve day after 90 days for each benefit period, up to 60 days over your lifetime. That's your lifetime reserve, okay? For each day after the lifetime reserve, you pay 100% of the costs. Medicare does not pay for your long-term health care beyond 100 days, and they don't pay that much really beyond 91 days. You don't have to pay a deductible for the care that you get in a qualifying long-term care hospital if you are already charged a deductible for the care that you got for prior hospitalization within that same benefit period. This is because your benefit period starts on day 1 of your prior hospital stay, and that stay counts towards your deductible. For example, you are transferred to a long-term care hospital directly from an acute care hospital, or you're admitted to a long-term care hospital within 60 days of being discharged from a hospital. Long-term care hospitals specialize in treating patients that are hospitalized for more than 25 days. Patients include people who have used like a ventilator for extended periods of time, so that's happening a lot right now, or experience a severe wound or head injury. What do you have to pay to be a part of Medicare Part A, and who qualifies? Well, actually, most people don't have to pay a premium for Part A. You've already paid into the system in the form of a Medicare tax deduction on your paycheck. If you have worked for more than 40 quarters or at least 10 years and you're over 65, you are fully insured in Medicare Part A, and premiums probably won't cost you anything additional if you meet these requirements. You already get retirement benefits from Social Security or the Railroad Retirement Board. You're eligible to get Social Security or railroad benefits, but you haven't filed for them yet. You or your spouse had Medicare-covered government employment. You'll probably get Medicare Part A premium free in this case. You can also get it for free if you're under 65 and you have been on Social Security disability or Railroad Retirement Board disability benefits for 24 months, or you have end-stage renal disease and meet certain requirements. In any case, Medicare Part A isn't totally free. Medicare charges a substantial deductible each time you're admitted to the hospital, and it changes a little bit each year. But for 2020, that deductible is $1,408. You can buy a Medicare Advantage or a Medigap policy to cover some out-of-pocket expenses such as deductibles and other parts of Medicare. Medicare Part A pays for virtually all hospital services for the first 60 days you're in the hospital. There are some exceptions, of course. It won't pay for a private room. For example, if you're a U.S. citizen or a permanent resident and have not worked long enough to qualify for Medicare, you may be able to buy into the Part A premium. If you buy Part A, you'll pay up to a maximum of $458 per each month, but most people pay less. If you paid Medicare taxes for less than 30 quarters, then you're going to pay that full $458 per month. If you paid Medicare taxes for somewhere between 30 and 39 quarters, the standard Part A premium is $252 per month. In most cases, if you choose to buy Part A, you must also have Medicare Part B, medical insurance, and pay monthly premiums for Part A and Part B. It's important to note, because I get this question a lot, there is no income test or asset test for Medicare Part A. No matter how much you earned, if you qualify based on the amount of time that you worked, 40 quarters, and you're over 65, you qualify. Thank you very much, guys. I hope this helps you out. This is just a short primer on Part A. If you have any questions about something specific regarding Medicare, please put it in the comments below. I look forward to hearing from you folks. Thank you very much. Have a nice day.